I'm paying for my son's hospital medical bills, and he's 28 years old, and I have no choice, it's going to cost me more.
It's going to cost you regardless whether he's on his own plan or your plan. But it's going to cost you less on your plan
That's like
because
saying
the
I
risks are
got to
spread
buy
out.
him a car when he's up to the time he's 28 years old. If the government makes me buy health care, what's going to prevent the government from telling me I got to buy my son a car?
I mean, the government taxes me, right? They pay for these roads, they buy aircraft carriers, jet planes. I don't want an aircraft carrier, but I'm forced to pay that. So that's the thing. This is just an alternative form of taxation that already exists, right? And my payroll tax goes into Medicare. It helps to pay for all these seniors here.
Anything at Jamestown, the communal economic system is not working.
Well, this isn't
Well,
communism.
what is the military? The military is the biggest bureaucracy in the world.
And it says in the Constitution to provide for the national defense.
And they do a pretty good job of it. And they're a bureaucracy.
We're obligated to pay for the national defense.
Right.
But we're not obligated to buy everybody food. We're not obligated to buy everybody health care coverage. We're not obligated to buy everybody a car. We're not obligated to buy everybody birth. We're not obligated to buy everybody birth control.
But not every policy decision is made on a constitutional obligation. I mean, all these buildings around here.
It was so good. Why didn't Barack Obama cover him and his family?
But see, this is the point. This is not a national single-payer health plan. You are not on the Obamacare plan. Obamacare is an individual mandate. That's the goal. If that's the goal, then I want that goal. But that's not the reality. That might be the goal. It's not. That's factually false. Before he ran for president was before this law was passed.
Labor unions of my goal is national single-payer health care.
And that's my goal
and it's going to take us a long time to get there.
Right. So you need a law to pass that. This is what's in there is not that
law.
law.
Why do you want a single-payer plan where you have no option?
Because risks are spread out over so many people. You get cheaper and better care.
You know why computers and cell phones get better? Because you have an option with what you want to buy. If you don't like a product that somebody's giving you, take it to somebody.
But health insurance
single payer,
I also
very complicated.
It's a little disturbing that you're talking about the effort to cure sick people to buying a computer. It's not a product. You're not picking up your health care and going home and playing it on the TV.
Why did Obamacare do away with the breast cancer for women?
They didn't do away with it. They did a cost-benefit analysis and realized that if you want to pay for that test on your own, that's perfectly fine. The government isn't going to do it because they don't think that it's worth it to have every woman have a breast cancer screening.
They took
so
the
this is the government.
So that drug away. A lot of procedures start out to be very expensive, but now they took that option away. They will not approve that drug for breast cancer treatment.
You're mixing
under Medicare.
You're mixing
if you have a private insurer, you can pay for whatever you want. This is expensive insurance, not care.
Most private insurers will not cover it now because the government will not approve it.